Lateral violence is violence or abuse occurring between workers and includes both overt and covert acts of verbal and nonverbal aggression. South Carolina nurses on the issue of horizontal violence, more than 85% of respondents reporting being victims. 60% of new nurses leave their first job within 6 months due to lateral violence. Lateral violence not only affects the patient and the families, it also affects the staff, the hospital, and everyone in that environment. Now we're going to have a scenario on lateral violence.
Knock, knock. Hello. Hi, I'm Penny. I'm going to be your nurse today.
Penny.
Alright. I'm going to hang some Pitocin.
What's that for?
It is to help your baby.
Okay, is there anything wrong with my baby?
No, not yet.
Okay.
Not yet.
Not right now.
Okay.
Yeah.
Well, you sure? Do I need to have that? Or can I just, what does it do? How's it going to help me?
It's going to help your baby. Yeah. Help you have your baby.
Are we ready for this?
I don't know.
What are you doing?
I'm hanging Pitocin for her.
Did you ask her name and date of birth? I didn't hear it. I was out in the hall and I did not hear it.
Her name's Pam.
But you didn't check her bracelet or anything.
It's okay. My name's Pam. I was born in 1970.
Alright.
Well, give me this thing. You don't know what you're doing. You've been working here for 3 months and you still don't know what you're doing. Sick of these new nurses. They just underpay us so much, and my goodness, for training these old nurses, these young things don't know what they're doing.
Are you having a bad day, ma'am?
No, I'm doing just fine.
I'm not. I'm very nervous. I'm very upset.
Let me see your ID. Well, at least you finally got the right bag this time. All right, I'm gonna hook this up to you.
Is there anything I should be like worried about?
This is
or-
Pitocin, and it's gonna help increase your contractions. Since you don't know what you're doing, why don't you go and do some charting?
Oh. Alright.
I'm sorry, I apologize for this new nurse. She don't know what she's doing.
And what was your name?
I'm Leah.
I just don't feel comfortable here. I don't know if I want to stay and have this baby here. It's our first baby.
I think we need to go somewhere else.
I think we do. Is there someone we need to talk to?
I'm gonna go find somebody.
It's very upsetting.
Because I don't think these people know what they're doing. And that lady that just came in, she was just rude.
She was rude, and it's not our fault.
No,
This
it's
is supposed to
not.
be a wonderful time of our life, and it's not our fault. She was so ugly.
I'm angry. I'm going to find somebody right now.
Well, don't get yourself too worked up now, honey. I need you.
I won't. I'll be right back.
Okay.
Yes, come in.
Can you tell me who's in charge around here?
That would be me. My name's Christy. I'm the charge nurse on this floor. How can I help you?
I need somebody to come into my wife's room and talk to us. We had a nurse in to give my wife some medication, and she was doing perfectly fine. And then this other nurse acting all crazy came in, jerking stuff away from her, telling her that she didn't know what she was doing. She's got my wife all flustered. My wife is like all anxious and stuff now. We want to leave the hospital and go somewhere else.
I am really sorry that you had to go through that. What's your wife's name and your room number?
We're in room 401, and my wife's name is Pam, and my name is Bert.
Bert. Well, Bert, it is nice to meet you. Once again, my name's Christy, and I'm the charge nurse here. And I hate you had to go through that, and we will take care of it. I will definitely talk with my nurses, and we will all be in there together shortly to help comfort your wife, because this is supposed to be a great time for her and you during
Yes, it is.
child labor, and we want to relieve any stress and anxiety, and that was not our intention. So we will definitely fix it and make it right for y'all.
Part of our faith, the baby needs to be brought into a stress-free environment, and that leads to a more stress-free life. So it's very important that we have a calming environment in
I
here.
understand completely, and we will make sure that happens. We will
Okay.
definitely discuss this and come in there and talk with y'all.
Okay, I appreciate it.
You're welcome.
Thank you.
You're welcome.
Hi, Christy.
Penny, come on in.
I've had an awful day.
Tell me what's going on today, Penny.
Leah's been awful. She won't let me do anything, and she acts like I'm so bad at nursing.
Well, Penny, you're a great asset to this.
No, she's been rude.
Well, you know you're a great nurse here, and you should not let other nurses get you down like that, Penny.
I don't want to be a nurse anymore.
Well, I will have a talk with Miss Leah and to let her know that we don't accept that in this work environment.
What's going on in here?
Leah, Penny was just telling me how you treated her in front of a patient.
She don't know what she's doing. She's been working here for 3 months. I have been training her, and she still doesn't know what she's doing. This is just unacceptable.
Well, can't you show me how to do it?
As nurses, we all need to work together as a team in this facility and be able to work comfortably and be knowledgeable with other nurses and staff, especially in front of the patient, so they don't feel more anxious than they already have been while they've been here. We need to learn to work together and not cause anxiety for each other, and you'll need to learn to be nice.
Well, maybe you need to find a different nurse that can train Penny. I just cannot take her being with me for 3 months and still not understanding what she's doing. I mean, she can't even hang fluids, and she can't even ask the patient what her name and date of birth is, or even look at her bracelet. I mean, it's just unacceptable.
Well, we will definitely switch staff, because if you don't feel like you're confident enough to help train
These
another
new
nurse. Now you're gonna see the proper example of working as a team in a healthcare environment.
Hello.
Hi, I'm Penny. I'm going to be your nurse today.
Hi, I'm Leah.
Hey, Miss Leah, how are you?
Good. I'm training Penny.
Okay.
So I'm just tagging along today.
I'm going to give you some Pitocin. That's to help help your contractions come along.
Okay.
Penny, I'm here if you need me. Make sure you do good hand hygiene and use proper gloves. I'm just here if you need me.
All right. Can you state your name and date of birth?
Pam Powell, January 1970.
All right.
So how long have you been nursing?
3 months.
Awesome.
Mhm.
Awesome.
I have a good teacher.
That's always very
Yes.
important.
Oh, yes.
Very important.
Are you excited about having is this your first baby?
This is my first baby, but we're gonna have a big family.
Is that a girl or boy?
We're not sure.
Oh.
All right. I'm going to give you your IV here on your IV site.
Okay.
All right. Y'all need anything?
I think we're okay.
I'm good.
All right.
Just call us if you need anything. The call out button is right here, and we'll be right here for you.
Okay,
Thank
you.
you. Congratulations, you did a great job.
Thank
I really
you.
like this hospital.
Yes, you're becoming an excellent nurse. I'm so proud of you.
Oh, thank
And
you.
you know, if,
Those
even down the
graduation
road, if
cards
you
or
need me, I'm
something
always
like
here
that,
for
I
you.
really
Okay.
appreciate
One of those, we can fill out one of those cards that we saw 2 superstars
that.
today.
Yeah, that'd be great. That'd
Yeah.
be great. Awesome.
I think I wanna go talk to somebody that's in charge and let them know just what great employees they have.
Do that. That'd be
Okay,
awesome.
I'll be right back, honey.
I would go with you if I could.
Yes, come in.
Hey, can you tell me, are you still the lady in charge?
Yes, sir, my name's Christy, I'm the charge nurse today.
Okay, I just wanted to let you know, my wife and I are in room 401. We're having a baby today.
Awesome.
And I just wanted to let you know that you have 2 really great nurses working for you. One's name is Penny, and one's
Penny.
name is Leah.
That's 2 of our greatest nurses here.
And they are just super duper nice and wonderful.
Well, I'm so glad y'all are having a great experience, because that's definitely what we want here. We want our staff and our patients all to mesh well and have beautiful babies.
Thank you. Do you have a couple of those papers to fill out that says that we saw like a superstar today?
Yes.
Are they in the room?
I can actually bring you some. I'll bring some
Okay.
down for y'all
Okay,
right
we'd
away.
like to do that.
Well, thank you for letting me know about this.
Okay, thank you.
Have a great day.
You too.
All right. How do you chart that?
Go ahead and put her vitals in.
All right.
Her heart rate, temp, blood pressure. Did you ask her if she was in any pain?
I did.
Penny, Leah, may I speak with y'all for 1 second?
Yes,
Yes.
hold on 1 second.
Come on in, have a seat.
Okay.
So, I just had, a patient's husband in room 401. His name is Bert. He just came and wanted to let me know how great my 2 nurses were doing in there with him and his wife Pam.
Oh, they're so sweet.
It's nice to see that y'all 2 can work together as a team, and for you being such a great mentor. I feel like I'm just gonna buy y'all lunch today, because I just love when my team can work really good together.
Well, thank
Thank
you.
you.
It also helps having a good charge nurse and manager. I mean, it's a great place to work.
Thank you, that's the way it should be, all of us getting along, because work goes so much better and patient care is we just want happy babies born and happy patients in our hospitals. So thank you, ladies.
Thank
You're doing
you.
a great job.
That's right. They're excited. It's their first baby, so we wanted to make it extra special, because you never know if they might have another baby.
Well, you want them to come to this hospital,
That's
so
right.
keep up the good work, ladies.
Thank you.
According to Amanda Murray, recognizing behaviors associated with lateral violence are well as those behaviors being normalized in a work environment are some of the most significant barriers to combating lateral violence. This is why education and awareness are some of the first steps in combating lateral violence. 8 behaviors are most frequently known in the workforce. They are isolation, public humiliation, backstabbing, withholding assistance, fighting, blaming, intimidation, and excessive criticism. Each of these behaviors can be seen in both overt and covert ways, which can make it challenging for staff and leaders to identify behaviors and participants. Since some of these behaviors are subtle, it may have become the cultural on the nursing unit for some to even be acceptable. For as many ways as there are to perpetrate lateral violence, there are just as many ways to stop it. A zero tolerance policy and education are good places to start. They set the tone that must be reinforced by leaders, both in official positions and by leaders in informal roles. It is worth noting that policies and education alone are not effective without additional strategies. It can also help to look at interventions focused on each participant in lateral violence: the perpetrator, the victim, and the bystander.
Lateral violence affects both current and personal practice in nursing. According to the article Horizontal Violence in Nursing, featured in MedSurg Nursing, a victim of lateral violence can suffer low self-esteem, anxiety, depression, and sleep disorders. The victim may also feel powerless and angry. When all of these feelings come into play, the nurse may start being absent from work, and his or her job performance will likely be affected. This can lead to adverse effects on patient care, such as medication errors, missed assessment findings, and failure to report pertinent information to the next nurse assigned to care for the patient. The same article, Horizontal Violence in Nursing, identifies how lateral violence actually ends up costing a facility money. The article states that, quote, the financial cost of horizontal violence has been estimated to be $30,000 to $100,000 per year for each individual. Costs are incurred as a result of work absenteeism, treatment for depression and anxiety, decreased work performance, and increased turnover. The estimated cost of replacing just one specialty nurse, such as an ICU or surgical nurse, may exceed $145,000, end quote.
In an article called The Disruptive Force of Lateral Violence in the Healthcare Setting by William Radford, he stated that there are many contributing factors in lateral violence. Some are organizational structures, nursing workloads, management, and personal factors. Some of those are when nurses are often confronted by heavy patient loads and burdened by time-sensitive multitasking, critical roles, and responsibilities, which may leave them frustrated and susceptible to conflict and ultimately lateral violence. Management was another contributing factor to lateral violence, leading to leadership and management styles, which plays a significant role in the onset and maintenance of lateral violence in the healthcare workplace. Another contributing factor is personal factors. When nurses have low self-esteem and sense of worth, respect and regard for others is unlikely, creating a peer relationship dynamic in which lateral violence is fostered. Furthermore, nurses need to participate in the training of new nurses, ensuring that nurses are empowered as they enter the healthcare workplace, thereby providing new nurse protection against abuse while also helping the new nurse understand how to avoid becoming an abuser.
This atmosphere of lateral violence creates an unhealthy work environment, while a distrust of peers creates the potential for patient error and compromises patient care. Nurses, we must combine our voices to deal with lateral violence in a professional manner. If you see or are involved with or are a victim of bullying or lateral violence, be the professional and seek to resolve the conflict. One way to succeed includes researching the topic of bullying with a concentration on lateral violence. Lateral violence can only be stopped by nurses taking an active role in striving for zero tolerance among all nurses in all settings. This is per Janet Donahue in Striving for a Zero Tolerance of Lateral Violence. Thank you.
In the past, lateral violence was largely ignored. Nurses eating their young was a common phrase. While today's environment is better for both patients and hospital staff, this doesn't mean lateral violence is no longer an issue. As a nurse leader, it is up to you to create a plan to change attitudes and behaviors and finally putting an end to this problem. As is often the case with bullies, those who are bullied tend to become the bullies. Establishing policies to address lateral violence and holding workshops that teach better ways to handle disputes are a good start to ending this cycle. Changing the attitudes of some of your well-seasoned nurses, particularly those who believe they're just showing tough love to younger nurses, may not be easy. Developing a mentorship program where seasoned nurses mentor younger coworkers can help combat this problem. When longtime nurses are invested in the success of another nurse, they may be more likely to encourage them rather than tear them down. Other ways to reduce lateral violence include providing conflict resolution training to nurse managers, encouraging teamwork, and involving human resources. Another strategy is creating peer support. Peer support is another strategy that is important for positive work environments. Building relationships and supporting one another can be done in a formal or informal fashion. Nursing units should be assessed by both nursing leaders and staff to raise awareness of lateral violence. In addition, promoting the use of employee assistance programs for individuals who demonstrate negative behaviors or those as victims of lateral violence can be an essential approach. Implementing policies to deal with organizational culture and lateral violence are crucial to this issue. Nurse leaders must take accountability to create these policies in support of nursing staff. Components needed for successful unit-specific and organizational policies include zero tolerance toward violent or abusive behavior, allowing anonymous reports, and protection of staff from retribution if concerns are reported.